Health system strengthening as a term is so broad as to be almost meaningless. I mean, it can encompass making sure that all the hospitals are available to people in the country, and that they're all fully staffed, and that they have the right equipment, and that the people there have the right training, and they've been certified, and so forth. It could have to do with getting access to care, but it can have everything to do with everything all the way back up to making sure people have potable water and safe ways to deal with sanitation and decent food to eat, and that their streets are safe, and so forth. So anything you do to strengthen the health system is one of those things. We tend to focus on upstream, powerful influencers of health that in America we call public health. So I'd be looking at strengthening health systems as they relate to making sure their country is able to say what's making people sick. Having a surveillance system that says this is where much of our health problems are, or it turns out this is no longer infectious disease, it's chronic disease, at least in our cities or urban centers and so forth. So that kind of basic information is a fundamental thing to my mind of creating health system strengthening. Another would relate to laboratory capacity. Another would relate to information capacity, and another would relate to outbreak investigation capacity and so forth. So it's a very broad term, and I think we at the task force tend to look at it in terms of those upstream fundamental underpinnings of a health system. So we've clumped our programs into neglected tropical disease programs, which tend to be vertically oriented toward a specific disease or maybe a couple of related diseases. We have a set of vaccine programs, and then we have a group of programs that we call health system strengthening programs. In truth, all of those programs touch on health system strengthening in some regard. The difference is really in how focused they are on a particular disease or a particular intervention, as opposed to a broad stroke sort of thing of building a workforce, for example, that's generally capable of doing something, whether it's building information systems or doing outbreak investigations or what have you. So ideally, I would think all of our programs should be asking the question, when we're done, when our program is successful, that will be wonderful, but have we also left behind an institutionalized, stronger health system for the work that we've done? And the truth is, in the history of global health, there are many, many occasions where people have gone in and done good work and left the system no stronger than it was before. And many times the gains from those interventions have been lost very quickly. So we tend to look at making sure there are systems put into place that allow us to maintain the gains that we get from our more vertically oriented programs.